The most important measure that we heard in the budget was the announcement of the $2.8 billion PBS New Medicines Funding Guarantee. This funding guarantee is dedicated to enable new medicines to be listed in a timely, prompt manner on the PBS and will be added to the Medicare Fund. This removes the requirement for the offset policy. At the moment, medicines have had to require to find an additional offset in order to get listed. By removing the offset policy, medicines can be listed promptly and quickly so that they are available for Australian patients when they need them. The landmark PBS funding guarantee for new medicines listings is a unique budget measure that provides new money into the PBS at a time when we recognise that new medicines are critical to the health of Australians and to the economic recovery of Australia. The innovative medicines industry has a range of new therapeutics, vaccines, and treatments to bring to the Australian population. What this does is it provides headroom for the government to list those medicines and make them available to Australian patients as quickly as possible. Medicines Australia has a strategic agreement with the Commonwealth until the July 2022. We now have a framework in place to agree a future agreement from 2022 until 2027. This provides an unprecedented 7 years pathway of predictability and certainty for the industry and for the Australian patients who will benefit from industry medicines. The reason this is so important is because it recognises that predictability and certainty in the business environment helps grow innovation, helps grow jobs. It also recognises that a healthy Australia contributes to a healthy economy. We are really looking forward to working collaboratively and constructively with the Australian Government to deliver on the framework that was announced in the budget. One of the important things is a move to streamline monthly rebate payments for our members to support the supply chain, instead of some previously proposed supply chain reforms that were difficult to implement. This represents a very important advancement to our current processes. There's also been a commitment to introduce unique identifiers for medicines within the supply chain, and this will improve tracking and traceability of medicines, improve access, and improve patient safety. There have been some announcements of further transformation in health delivery seen with COVID-19, including home delivery of medicines, telehealth, and digital reforms to the TGA have been announced recently. These are all extremely important measures to take place over the coming months. Our priority is to lock in the next strategic agreement for the May 2021 budget. There are substantial elements to be addressed that require consultation with our members and further discussions and negotiations with government. We believe a very important chapter in innovative medicines and health has begun that builds upon the substantial collaboration during COVID-19. We take our responsibilities extremely seriously and are fully committed to creating a strong and certain future for innovative medicines in Australia and the patients who receive them.